right? Okay. Been having a lot of intense pain in my right knee around the area at the immediate top of the shin, just below the kneecap. No official diagnosis, but all symptoms point to Osgood Schlatters. Any advice, experience dealing with this, especially when deadlifting, as any impact or pressure in the area results in intense pain? Clint, how old are you? All right. Osgood Schlatters disease is almost entirely a disease of adolescence and early teenage people. Sometimes you'll see people with Osgood Schlatters or maybe as old as 18, but nobody's got Osgood Schlatters when they're 25 because it is an inflammation of the growth plate at the proximal tibia. That's what it is. It's an inflammation of the growth plate. People with Osgood Schlatters will have an enlarged area on the anterior side of that growth plate. It's a bump, and it does hurt to hit it with a bar. It certainly does. But since growth plates settle down by the time you're post-adolescent, post-teenage, Osgood Schlatters goes away. Depending on if you're 25 years old and you're writing me this, you've got something else going on. Osgood Schlatters is what kids have. And what we do with it is we train through it. You train through it. You squat, you deadlift. You try not to bump the knee. Put a wrap on it or whatever you need to do to not bump it because it does hurt and it's real distracting. But Osgood Schlatters is a kid's thing. And if you're not a kid, that's not what you've got. Okay?